16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry. Our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hello viewers, good evening to all. Welcome to this week's episode of KIMSHEALTH Dr. Live. Myself, Kripa Rajiv. Today, in this episode, we have taken the topic nasal congestion. To talk about this topic, we have an efficient doctor with us. It's my pleasure to welcome Dr. Riju Jayaraju to the show. He is an ENT specialist working in KIMSHEALTH Hospital, Umalasam. He has 8 years experience on comprehensive ear, nose and throat care. Hi doctor, welcome to the show.
Thank you.
How are you doing?
I'm good.
Doctor, can we move on to the discussion?
Sure.
During this COVID pandemic, we are forced to wear masks, and more people are complaining about breathing difficulty, nasal congestion or block. What is the reason for this?
So nasal congestion had always been there from times unknown. But during the pandemic, because people are using masks more and more, in fact we are forced to use masks, the incidence of nasal block or people coming to doctors with nasal block has increased. That is one observation which I've made in the past 2 years. So there are a lot of n number of causes for nasal congestion, or the technical term which we use is nasal obstruction. So again we can divide that into causes in children, because some causes are very common in children and even in adults. So coming to the reasons in adults, one of the commonest one which we find is deviated nasal septum, or the bridge of the nose. In layman's term we say bridge of the nose. So there is a bend in the bridge of the nose which is called deviated nasal septum. That is one of the commonest causes. Then the second commonest one which we have is allergy related. So when it comes to allergy related, I should specifically say that in the Middle East we have a high incidence of nasal allergy or allergic rhinitis. So one of the commonest manifestations of allergic rhinitis we see in the nose is something we call it as turbinate hypertrophy, or we say a mass in the nose. In Arabic we say lahmiya. So that is one of the second commonest cause which we see in the OPD. And the third one is again a manifestation of allergy which is called a polyp in the nose or a growth in the nose, which is again called lahmiya in Arabic itself, but these two are entirely different. And then there are other very rare causes like some sort cancers in the nose, or some infections like rhinosporidiosis. All these can cause nasal congestion or nasal obstruction.
So doctor, how you diagnose or differentiate each of these conditions?
What we basically do is called a direct examination, which most of ENT doctors from the olden days we have been using headlight to examine the patient. But the area of the nose which we get to examine or which we get to clearly visualize using a headlight is very limited. So we may have to go for some sophisticated investigations like endoscopy, or which is otherwise called diagnostic nasal endoscopy. So diagnostic nasal endoscopy is one of the investigation which can diagnose most of the conditions in the nose. And second one is CT scan. X-ray of course was used in the earlier days, but the current standard investigation for diagnosis of most of the nasal conditions is a CT scan.
So doctor, which all patients just need a medication and which all need a surgery for these conditions?
So once the patient comes to us and we finish the investigation either by a CT scan or a diagnostic nasal endoscopy, next step is, okay, we have almost arrived at a diagnosis, provisional diagnosis. So it may be a deviated nasal septum or a polyp in the nose, or growth caused by tumor or a rhinosporidiosis, or it may be just allergy related turbinate hypertrophy, or even the conditions called chronic sinusitis. So once we reach the diagnosis, if it is a patient who is presenting for the first time, most of the time the patient would be also preferring medical treatment. Patient would be thinking, okay, I will try with medications first rather than going for a surgery. So in all these patients, allergy has to be treated with medication. Allergy treatment will be there, which even if the patient is getting operated, even if the patient requires a surgery, allergy treatment has to be there. But there are certain specific conditions which cannot be treated with medications. And one reason why some of our patients are a little scared of surgery is because some misconceptions are there that these conditions might come back again, recur again. So conditions like deviated nasal septum is one which has no medical treatment. So it is basically a bend in the bone or the cartilage of the nose, which is an anatomical abnormality and which has to be dealt with surgery only. So there is no medical treatment for that. Then second one is turbinate hypertrophy. That is again increase in the size of the bone, or like I said in Arabic we say al-hmiya, which again to a smaller extent can be treated with medicine. The patient may get a symptomatic relief, but over the long term the patient may also have to go for surgery. And the third condition is sinusitis, wherein the patient may most of the time require surgery. Even in a condition called nasal polyp, most of the time the patient requires surgery and then followed by medical treatment. So to sum up, most of these conditions, for a definite treatment, surgery is mandatory.
Okay. Doctor, after the surgery of nasal septum, will there be any chance to get blocked it again, or will there be any complications because of the surgery?
There are so much of misconceptions that after a surgery of nasal septum, there can be block. But if it is a surgery done with proper infrastructure and with a trained surgeon, then the chances of any complications or nasal block happening again is very, very less.
Okay. Then one more, for sinusitis, what type of surgery is performed?
So the current international standard surgery done for sinusitis is called FES, or we otherwise call it functional endoscopic sinus surgery, or in simple terms we can say sinus surgery or FES. So all these surgeries are done using an endoscope, so which actually means that there is no external scar involved, and the patient will have a very short stay at hospital, which is less than 24 hours. Suppose a patient comes to hospital today, the next day patient goes home.
Okay. Doctor, we need to talk more about this topic. Before that, let's have a small break. Welcome back to KIMS Health, Dr. Live. Can we continue, Doctor?
Sure.
If we ignore these conditions, like what you told, what could happen in future?
There are certain conditions which can lead to complications. For example, sinusitis is one of the conditions which can lead to complications in the brain. The reason being, the nose is very anatomically very close to the brain. So there is the roof of the nose, or the part of the nose above the nose is just continues as the brain. In between there is a very thin bone and just a thin mucosa. So this is the reason why complications of sinus infections can spread to the brain very frequently. Of course, with the advent of newer antibiotics, we are seeing less of complications these days, but even then, once in a while, we get complications of sinusitis. So the commonest complication in the brain because of sinusitis is meningitis, that is infection in the meninges of the brain, or an abscess in the brain, encephalitis. So these are some of the intracranial or brain complications of sinusitis. And even commoner ones are the complications in the eye. Sometimes the sinus infection can spread to the eye again because of the anatomical proximity. We get infections like orbital cellulitis or orbital apex syndrome, where the infection from the nose spreads to the eye and the patient comes with a swelling in the eye. But when we take a scan of the patient, we see that the infection in the eye has actually come from the nose.
Doctor, regarding this one, just now you told me that the sinusitis may affect to the brain if it is in a long run. So how we will understand our prevailing condition is a sinusitis or not? What are the causes? How we can identify?
So we get a lot of patients with headache in our OPD, and most of the time the patients come saying that I have sinus problem. So I sometimes ask the patient, how do you know that you have a sinus problem? So sinusitis is basically the, as I said some time back, the diagnostic tools for sinusitis is One is a diagnostic nasal endoscopy, which is done again in the OPD, and second one is a CT scan, which is again done in the hospital. So without these two, we cannot exactly diagnose that it is sinusitis. And there is also a popular misconception that all headaches or all headaches in this part, in the front part or above the eyes, any headache is sinusitis. That is also a common misconception, because there are a lot of other conditions causing headache, like vascular headache conditions like migraine, and then we have something called cluster headache syndrome, and then there can be even headache due to any abnormalities in the vision or visual refraction abnormalities also can cause headache. So the diagnostic tools of diagnostic nasal endoscopy and CT scan are most essential to confirm the diagnosis of sinusitis and to prove that the headache is due to sinusitis.
Doctor, usually when we wake up, some are sneezing continuously. So how allergies like running nose and sneezing can be treated effectively?
So again, in the Middle East countries, we have a very high incidence of allergic rhinitis. So there are certain factors which are responsible for a person having allergy. One is definitely the genetic makeup of the person. For example, it runs in families. A family member like a father or mother may have allergy, the children also might have allergy. Second thing is the environmental factors like exposure to dust, exposure to pollen, exposure to certain fine particles at home. So now what we have to do is, when a patient comes with a very sickening allergy, they will be sick and tired of this allergy. Once they get up in the morning, like you said, they will be sneezing right from the morning. So for all these conditions, once the patient comes, we actually subject them to certain investigations, which is other than treating them blindly, we subject them to certain investigations. We have investigations in our hospital like allergy testing, wherein we do skin prick testing of certain allergens. For example, we do not know what you are allergic to. So we have a panel of allergens which we test by a small prick on the skin, and then end of it we give the patient a result that these are the allergens you have. So first thing advice to the patient is to avoid all these allergens, whatever they are allergic to. And second thing is treatment with certain medications. So medications can be antihistamine tablets or leukotriene antagonist tablets, and even nasal sprays. So these are the current treatment of allergy. And then there is one more advanced level of treatment of allergy, something called immunotherapy, wherein we give the specific treatment for the specific allergen to the patient.
What is the cause of nasal congestion in children?
When I started the discussion, I was telling you about it can be broadly classified into causes in children and causes in adults. So when it comes to children, of course, children also might have this deviated nasal septum or bend in the bridge of the nose, or even enlargement in the bones called turbinate hypertrophy. So for all these conditions, we can only treat children with medications up to the age of 16 years. For example, a child with deviated nasal septum, which is very severe, presents at the age of 5 years or 6 years, we can only treat them with medications. But once the child reaches 16 years, we can think of surgical treatment for the children. The main reason is because the nose of the children is also growing as the child grows. So most of the time, there is a chance or a possibility that the deviation can get corrected by itself. Second thing, if we do a surgery at a very young age, there can be also a problem in the proper growth of the nose. So there is a reason why we defer the surgery for these conditions up to the age of 16 to 17. And then the commonest condition which we see is something called adenoid in children. Most parents must be aware of the condition called adenoid. Adenoid is actually something like a tonsil. Like we have tonsil in the throat, above the tonsil or behind the nose, we have something called adenoid. That is also a part of the tonsil. But for children, it enlarges in size. So the enlargement usually begins maybe from the age of 2 or 3 in some children. Some children by the age of 5, 6, it enlarges in size. And children who are subjected to allergens or who have allergy by themselves, they might have a profuse enlargement of the adenoid to an extent that it can cause airway blockage. So children will not be sleeping at night properly. They will be biting their teeth at night. They will be opening their mouth and sleeping, which is called mouth breathing, and they will be having snoring also at night. So these are the symptoms by which we can diagnose this condition called allergy. So these are some of the commonest conditions or symptoms with which a child with adenoid hypertrophy presents. So that is the most commonest cause which we see in which children have with nasal condition.
So how it can be treated, doctor?
So when the child comes, the first part of treatment is always to diagnose it properly, and a common investigation which we do is a simple X-ray. So on a simple X-ray of the nasopharynx, we can diagnose whether the child has a significant adenoid hypertrophy causing a blockage in the airway or not. So most of the time it will be adenoid on top and the tonsil below. So both these together can cause airway obstruction. So that is the one of the diagnostic tools. And second diagnostic tool is a nasal endoscopy, again, which is sometimes done in children if the child is cooperative. But before surgery, most of the time we do an endoscopy itself to confirm the diagnosis of the condition. And when it comes to treatment, adenoid hypertrophies in children which leads to a severe obstruction or something called obstructive sleep apnea, that to an extent that the child will be snoring at night and will not have proper oxygenation of the brain at night. To that extent, if it goes, then most of the time surgical treatment is required, and adenoidectomy is the surgical treatment for adenoid hypertrophy in children. Sometimes we club the procedure with tonsillectomy because tonsil is also one of the factors which causes the obstruction.
How is hearing loss happens in children due to nasal block?
So now, just as we discussed about the adenoid hypertrophy, what happens is the adenoid is a mass, like I said, behind the nose and above the tonsils or above the throat. So that is the area where the tubes connecting nose to the ear. We always know that ear and nose has a tube connecting. So that is the area where the tubes connecting nose to ear opens up. So when the adenoid growth enlarges, so what happens is when the adenoid blocks the passage between nose and ear, there is something called a negative pressure within the middle part of the ear, that is the part of the ear behind the eardrum. There is a negative pressure and that causes fluid to accumulate in the ear. So the most important point in children is these children will be 3 years, 4 years, 5 years, they will not recognize that they have a hearing problem. Even sometimes the parents also, if it is good if they diagnose, if they realize that the child has a hearing problem, but sometimes even the parents also will not be understanding that there is a hearing problem. So there is a very simple test called Tympanometry where we check the pressure of the ear, which I feel has to be done in all the children with snoring and all the children who sleep with the mouth open. So with that simple test we can diagnose that there is a problem in the ear, the child has a fluid collection in the ear, and that is responsible for the hearing loss.
Doctor, we have noticed that there will be sudden bleeding from our nose. It can happen to adult as well as children. What is the cause of that?
So bleeding from the nose, we call it epistaxis. Okay, that is what we call bleeding from the nose, the technical term. So in children, the commonest cause is, we always say the commonest is the commonest one. So the commonest cause in children is just nose picking. Most of the children, they have a habit of using fingers to clear their nose. Okay. That is the commonest cause of nasal bleeding in children. However, we cannot just overlook by saying that it is just because the child has nose picked. However, we cannot just overlook by saying that the child has nose picked with his finger. So the main reason being there are so many other reasons. So when a child comes with nasal bleeding, what we usually do is we rule out any other clotting problem in the blood, because very rarely we have such children also with clotting problem in the blood and who present with sudden spontaneous bleeding. But though that is rare, it is important to do the test because that is a condition which we should not miss. And though the commonest one is a very simple condition and which is not at all problematic for the child, there are even other serious conditions. Then there are certain conditions like some tumors in the nose called nasopharyngeal angiofibroma. Again, it's common in children only. Children and adults in the age group, they will have this tumor which can again cause sudden spontaneous bleeding. So if it is recurrent, I would always suggest that you can take the child to a specialist and do these tests, blood tests, to rule out clotting problems and also to rule out any other tumors in the nose.
Okay.
Now when it comes to adults, the commonest reason is not this. The commonest would be hypertension. especially in elder adults, they will present with sudden bleeding, and at the same time their BP will be very high. So that is the commonest one in adults.
Doctor, if we are having a cold, will that be also a cause for that bleeding nose?
Yes, definitely. That is because the blood vessels in the nose, that is the arteries and veins in the nose, are very superficial. They are very thin, and the skin covering them is also very thin. So when you have a cold, there is a lot of inflammation. So when that inflammation is there, and if you just sometimes with just a sneeze, you can have a sudden bout of bleeding. Also, if you just try to pick your nose with your finger also, you can have a sudden bout of bleeding. So that is the main reason is there is a lot of inflammation when you have a cold or rhinitis. That is the reason why there is excessive bleeding during cold.
Okay. Why do people lose smell and taste after the COVID, and how it can be managed?
Well, that is one of the commonest reasons why people are coming to us now these days, because COVID is definitely a viral infection like any other viral infection, though it has some serious complications in some people. But any viral infection can cause inflammation in the nasal mucosa or in the skin of the nose. So the nerves responsible for smell are very closely related to the skin of the nose, and it is a very close communication with the brain, which are called olfactory nerves, which is in a very close proximity with the brain. And now what happens is when there is a viral infection like COVID, or even in other viral infections, even in a normal flu, you can have sometimes a loss of smell for a short period. But in COVID, what we have noticed in the past 2 years is that most patients, they will have a loss of smell for a very longer period of time, like 3 to 6 months. Some people take 3 to 6 months to get it resolved, which is also very sickening for the patient. So what happens is these nerves are actually blocked by inflammation from the viral infection, and that is one of the main reasons why they lose smell. But in 99% of the cases, what we see is it recovers. So we just have to treat the patient with nasal steroids and vitamins to strengthen the nerve, like vitamin B12.
So doctor, I think we have covered all the queries regarding this topic. Can you please sum up and give a takeaway message to our viewers?
Well, to sum up, the take-home message for the day is that nasal congestion, though it's a very common condition seen in most of us, we should not overlook by feeling that it's a very simple condition, because there can be so many other things inside which we do not know, which we cannot diagnose unless you go and meet a specialist.
Thank you so much, doctor, for joining with us. I hope our viewers found this episode very informative and useful. And today we discussed about the topic nasal congestion. Next week, same time, same day, we'll come with yet another doctor on KIMS Health Dr. Live. Till then, it's Kripa Rajiv signing off from KIMS Health Dr. Live. Take care and bye-bye.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Saraj Jewelry. Our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.